In 1961, during a Soviet expedition to Antarctica, Dr. Leonid Rogozov faced an extreme medical crisis. He began experiencing symptoms of general malaise, marked weakness, high fever, and sharp pain in the lower right part of his abdomen. These symptoms worsened over time, making it clear that he was suffering from a serious inflammation of the appendix, an urgent condition that required immediate intervention. The situation was truly dire. If left untreated, the inflammation could progress to a ruptured appendix, a potentially fatal event due to the spread of bacteria throughout the abdominal cavity and the resulting peritonitis. Rogozov was isolated, with a storm raging and no means of communicating with the outside world. The lack of adequate medical facilities and assistance made waiting for help impossible. Therefore, Rogozov had to make an extreme decision. He chose to operate on himself to remove the appendix. This was an extraordinary act of courage and determination, especially for a doctor fully aware of the risks and potential complications of performing surgery without any assistance. Appendicitis is a relatively common medical condition that can affect people of any age. Statistically, about 1 in 12 individuals will develop appendicitis during their lifetime. But why is the appendix so prone to inflammation? The appendix is a small pouch-like organ located at the junction of the small and large intestines. For a long time, it was considered a vestigial organ without any significant function. However, recent research suggests that the appendix may play an important role as a reservoir for beneficial bacteria, supporting gut microbiome health and immune system function, especially during episodes of intestinal infection. In most cases, appendicitis begins due to an obstruction of the appendix. This blockage is often caused by small fragments of hardened stool, known as appendicoliths. However, infections caused by viruses, parasites, or bacteria can also trigger inflammation. Once the entrance to the appendix becomes blocked, internal pressure increases rapidly, creating an environment conducive to bacterial growth. This excessive bacterial proliferation causes acute inflammation, which manifests as intense, persistent pain. This pain often starts near the navel before moving to the lower right side of the abdomen, becoming sharper and more persistent over time. If appendicitis is not treated promptly, the inflammation can lead to the appendix rupturing. When the appendix ruptures, the infected contents spread throughout the abdominal cavity, leading to peritonitis, an extremely serious and potentially fatal condition if not treated immediately. For this reason, anyone experiencing severe and persistent abdominal pain should seek urgent medical attention. Appendectomy, the surgical removal of the appendix, has been the standard treatment since the late 19th century and is typically performed within 24 hours of diagnosis to prevent severe complications. In many cases of uncomplicated appendicitis, it is possible to avoid surgery with targeted antibiotic therapy. Antibiotics can reduce inflammation and resolve the infection, allowing the patient to avoid surgery. However, while antibiotics can be effective in certain situations, appendectomy remains the safest solution to prevent recurrence. When the appendix ruptures, the situation becomes much more complex. The surgery requires not only the removal of the inflamed organ, but also the thorough cleaning of the abdominal cavity to eliminate bacteria and pus and prevent further infections. Dr. Rogozov's ordeal stands as an extraordinary example of courage, resilience, and medical skill. Despite isolation and extreme challenges, Rogozov successfully performed surgery on himself. After administering local anesthesia, he made the incision, removed the inflamed appendix, and stitched the wound, all without another physician to assist him. His ability to remain calm and complete such a delicate procedure is a testament to his abilities and determination. Incredibly, Rogozov made a full recovery within 2 weeks and resumed his normal activities. Rogozov's experience has imparted a significant lesson to the medical community, particularly to those working in extreme conditions or remote locations. His story underscores the importance of being prepared for any medical emergency, even the most unlikely ones. Today, thanks to the lessons learned from situations like Rogozov's, Expeditions to isolated places such as Antarctica are better equipped with medical supplies, including antibiotics and emergency surgical tools. This ensures that doctors have the necessary resources to handle critical situations and provide appropriate care even in the most challenging environments. Ultimately, while appendicitis is a common condition, it can quickly become dangerous if not treated adequately and promptly. Appendectomy remains the safest treatment to avoid severe complications, but advances in antibiotic therapies are opening new possibilities for patients. Rogozov's story reminds us not only of the dangers of appendicitis, but also of the extraordinary human capacity to adapt and overcome seemingly insurmountable obstacles when life is at stake. I would love to hear what you think in the comments below. Subscribe to the channel and activate the bell so you don't miss any content, and thanks for watching this video.